This video is for you if you have medical symptoms, pain, or illnesses that people say are in your head. Maybe you haven't heard this before, but I want to tell you there's a really good reason for your suffering, and it's not in your head. If you've been under chronic stress, especially the kind that comes from childhood trauma, every time you get a reminder of what happened, your body sends signals that create pain, inflammation, and illness. That means that if someone yelled at you often as a child, every time you make a mistake now that would have led to being yelled at as a child, your body responds as if you're getting yelled at now. This kind of stress from trauma triggers like these, even when they're subtle, cause many, possibly long-term consequences. If you're familiar with the ACE study, this is what that study's talking about. But it doesn't have to be like that. When you heal your trauma, and if you follow me, you know that means healing triggers, trauma habits, and compulsive behaviors that become habits because they were used so often to help you survive. Heal those things, and your body will also heal. Dr. Howard Schubiner says this: your body is producing pain because it's manifesting unresolved stress, possibly from your childhood, or from stressful events in your adulthood, or from your present circumstances, and as a result of your personality traits, which affect how you respond to stress and how much pressure you tend to put on yourself. Your mind has twisted your body into pain as a way to avoid some of the emotions that are inside you. If you haven't been helped by traditional or alternative medicine, the diagnosis may be mind-body syndrome, and most people have some form of it. But you don't have to live the rest of your life with this pain. I'll link his website in the description. Mind-body syndrome is also known by other names: tension myositis syndrome, central sensitization syndrome, psychophysiological disorder, stress illness syndrome, and psychosomatic disorder. And here's a list of diagnoses that could be a result of the mind-body syndrome. You're not going to believe how many things can be connected to this problem. Here's the list: heartburn, acid reflux, abdominal pains, irritable bowel syndrome, tension headaches, migraine headaches, unexplained rashes, anxiety or panic attacks, depression, obsessive compulsive thought patterns, eating disorders, insomnia, fibromyalgia, back pain, neck pain, shoulder pain, repetitive stress injury, carpal tunnel syndrome, reflex sympathetic dystrophy, temporomandibular joint syndrome, chronic tendinitis, facial pain, numbness, tingling sensations, fatigue or chronic fatigue syndrome, palpitations, chest pain, hyperventilation, interstitial cystitis or spastic bladder, pelvic pain, muscle tenderness, postural orthostatic tachycardia, tinnitus, dizziness, and post-traumatic stress disorder. These two books, Back in Control by David Hanscom and Unlearn Your Pain by Drs. Schubiner, both describe what I say, but from a medical perspective. And that is, heal the trauma and your physical health will improve. I'm going to talk more about this in future videos, but if this video speaks to you, just know that there's a way out of pain and suffering. The physical symptoms are a secondary sign that there's something wrong. Work to heal your trauma symptoms, which you can do without increasing the amount of pain that you're already in using the trauma erase method that I developed. I've put a link in the description so you can join me in my community where I'll help you with this work. I'm Tamara Ridge, the therapist that's been there. You don't have to stay in pain. I promise.